This will be the final video in the Training Toolkit series. We will be discussing the remaining steps that should be completed after conducting the hearing screening and discussing the results with families. Referring back to our acronym, this video will cover the last 6 steps in the hearing screening process: teach back, evaluate, address, refer, remind, and share. Teach back is asking parents to explain or repeat in their own words what they were told by the healthcare provider about their infant's hearing screening results and care. For example, it would be appropriate to say, "I want to be sure I explained your infant's hearing screening results clearly. Can you please tell me in your own words what those results mean and how we plan to follow up on those results?" This is more appropriate than asking, "Did you understand what I said?" or "Do you have any questions?" This method of parent education is used to check that the healthcare provider explained information clearly and that parents understand what they need to know about their infant's care. As a healthcare provider, you may re-explain and check again if needed. After teach back, you should evaluate for other considerations and risk factors. If an infant is to be transferred to a different hospital or unit, conduct the hearing screening prior to the transfer if the baby is stable, and communicate results with the receiving facility. If, however, the screening cannot be performed prior to the transfer, inform the receiving facility and the South Dakota EHDI program. There are midwives throughout South Dakota with access to screening equipment who have been trained to perform newborn hearing screenings. The South Dakota Department of Health has distributed equipment to train midwives across the state. Midwives who do not have access to hearing screening equipment should educate parents about the importance of newborn hearing screenings and set up a hearing screening appointment with another provider before the infant is 1 month of age. Newborn hearing screenings are available to families throughout South Dakota through the South Dakota School for the Deaf. Infants readmitted to the hospital during the first month of life with conditions associated with potential hearing loss, such as hyperbilirubinemia, meningitis, or sepsis, for example, need to have a hearing screening repeated prior to discharge. In many cases, the screening should be an AABR, not an OAE. In cases of significantly elevated bilirubin, infants should be referred for audiological assessment to include ABR measures after discharge. Infants with risk factors for hearing loss should be monitored by their primary care physician in the medical home. They should also have at least 1 diagnostic audiology assessment by 30 months of age. Infants with risk factors associated with late onset or progressive loss should be followed more frequently. The next slide will cover several of these risk factors. Here is a list of several risk factors for hearing loss. This is not an exhaustive list. A more comprehensive overview of risk factors is provided on the Training Toolkit page. Some of the major risk factors include a family history of childhood hearing loss, if the child was exposed to an infection in utero, such as toxoplasmosis, congenital cytomegalovirus, or rubella, if the child has any ear malformations or craniofacial anomalies, such as a cleft lip or palate, ear tags or pits, or atresia, if the child was exposed to ototoxic medications, if the child has a syndrome associated with hearing loss, such as Down syndrome or Pendred syndrome, if the child was in the NICU for longer than 5 days, if the child was born prematurely, if the child has hyperbilirubinemia, or if parents have any concerns regarding hearing, speech, language, or developmental delays. We will now discuss the final 4 steps in the hearing screening process. Address. It is important to obtain a valid and reliable address and contact information from parents. Ask parents for an address to use for follow-up reminders. It's best to ask parents or caregivers to provide an additional address that is permanent and can be used as a backup in case they move or there's an issue with reaching them on the primary address that they provided. Refer. Refer the infant for follow-up if necessary. If the result of the initial screen is a refer, ensure referral of the parent or caregiver to a medical home for further evaluation. Also obtain an authorization to share information with other state programs if applicable, per your facility protocols. Remind. Remind parents of the need for a second screen or referral if applicable. Work closely with the social worker or discharge planner at your unit to ensure that parents receive timely reminders. Ask parents about their preferred method for sending reminders, such as text message, phone call, or letter. Finally, share. Share and document information. Share the need for a follow-up screen with the medical home, primary care provider, and other healthcare providers if necessary. Document screening information in the electronic medical record. Include the time, date, type of screening, whether it was an OAE or ABR, and results of that screening and/or rescreening. Document parent education, referral information, and the preferred method for sending reminders, again, whether that's a text, phone call, or letter. A great resource that could be provided to parents is the website EHDI136.com. By creating an account and entering their child's name and date of birth, the website will walk parents through those 136 benchmarks, offering helpful information and resources along the way. The link to this website is provided on the Training Toolkit page. This completes the South Dakota EHDI Training Toolkit for conducting hearing screenings in the birthing facility. Thank you for taking the time to watch these training videos and learn the importance of newborn hearing screenings. Please remember to take the post-training quiz. You will be able to review your results and the correct answers at the end of the quiz.